All right, welcome everyone. We're going to do something a little different today. Think of it as a quick pop quiz, a challenge to see how well you really know that amazing hidden world inside your own body. Don't worry, it's all in good fun. Ready? Let's jump right in. Really think about it for a second. You live in this body 24/7, but how much do you actually know about what's going on under the hood? For most of us, it's a total mystery. So let's see if we can change that, just a little. Time for round one. Okay, first up, we're starting with the basics, the general layout of your abdomen. It's a super busy neighborhood in there, and every single organ has its own very specific address. All right, here's your first question. We're looking for the structure that lies behind the main lining of your abdominal cavity, the peritoneum. So is it A, the stomach, B, the spleen, C, the pancreas, D, the jejunum, or E, the transverse colon? Go ahead, take a second, lock in that guess. And the answer is C, the pancreas. If you got that one, nice job. It's kind of like the shy organ of the group, tucked away in the back. But that brings up a good question. What does that fancy word, retroperitoneal, actually mean? Okay, let's break it down. Retro just means behind. And the peritoneum is that big membrane, kind of like a sac, that lines your abdominal cavity. So retroperitoneal literally means it's behind that lining. I love this analogy. It's like the pancreas is backstage at a huge concert, while all the other organs are out there on the main stage. And you can see that really clearly here. The stomach, the spleen, the jejunum, the transverse colon, all those other options, they're what we call intraperitoneal. They're inside the main party. But the pancreas, from our list, is the only one with that special backstage pass. All right, you ready for round two? Okay, let's switch gears a bit. Now we're going to talk about how everything gets its fuel. Think of this round as mapping your internal plumbing, that incredible network of arteries that keeps the whole system running smoothly. So, every single part of your digestive system has its own dedicated blood supply. The question is, which part of the large intestine gets its blood primarily from the inferior mesenteric artery? Your options are the jejunum and ileum, the ascending colon, the transverse colon, the sigmoid colon, or the duodenum. What's your gut feeling on this one? And the answer is D, the sigmoid colon. Yep, this artery is responsible for the, let's say, last leg of the journey through the digestive tract. And what's so cool when you look at it this way is just how organized it all is. It's not random at all. You've got these major arteries, and each one has its own specific territory. The superior mesenteric artery, for example, takes care of the small intestine and the beginning of the large one. But our artery, the inferior mesenteric, handles the final sections, including, of course, the sigmoid colon. It's a really efficient system. Okay, so we've looked at where the organs are, and we've looked at their plumbing. Now let's talk about the very thing that holds it all in, your abdominal wall. And I'm not just talking about your abs or your six-pack. It's a way more complex, multi-layered structure than you might think. Right, we all think about the muscles at the front, but what's going on around back? So the question is, which of these muscles helps make up the posterior, or the back, part of the abdominal wall? Is it the rectus abdominis, external oblique, internal oblique, quadratus lumborum, or the transversus abdominis? And the answer here is D, the quadratus lumborum. This is a really deep muscle in your lower back, and it's absolutely crucial for your core's foundation. This basically gives you a simple map of your core. You've got the rectus abdominis up front, that's your six-pack muscle. You've got the obliques on the sides. But way back there, providing all that deep stability, is the quadratus lumborum. It's really the unsung hero of your abdominal wall for sure. Right, for our final round, we're going to take a pretty cool twist. We're shifting from modern anatomy to something more like bodily archaeology. We're going to look at the amazing historical landmarks that are left inside your body from a time before you were even born. This is where it gets really fascinating. A lot of the structures in your adult body are actually just remnants, leftovers of parts that had a completely different and totally vital job when you were a fetus. The ligamentum teres of the liver is a perfect example. So what was it back in the day, before it turned into a ligament? Was it the umbilical vein, umbilical artery, ductus arteriosus, vitelline duct, or the allantois? And the answer is A, the umbilical vein. Look at this transformation.
What was once a literal superhighway, pumping oxygen-rich blood from the placenta to the fetus, later becomes this simple, solid ligament in the adult liver. It's an incredible example of biological recycling.
And it's not just a one-off thing. This happens all over. The umbilical arteries, the ductus arteriosus, they all go through a similar transformation. They start as active, working parts in the fetus, and then become these simple ligaments after you're born. It's like your body is filled with these little echoes of your own past.
Okay, here it is, our final question. And it's a bit of a tough one. We're talking about the greater omentum. It's this fatty, apron-like sheet that hangs over your intestines. Sometimes it's even called the policeman of the abdomen. But what did it develop from? Was it the dorsal mesogastrium, the ventral mesogastrium, or the septum transversum? The answer is A, the dorsal mesogastrium. Just think about that. What started out as a simple little membrane whose only job was to hold the stomach in place, well, it grows and folds and turns into this huge, complex, protective apron in the adult. It's just another amazing story of development. So when you boil it all down, here's the big takeaway from all of this. Your body isn't just a static collection of parts. It's a living, breathing record of its own incredible journey, from a single cell all the way to the complex person you are right now. Every ligament, every vessel, every little leftover structure tells a piece of that story. And it really makes you wonder, doesn't it? If our anatomy is basically a roadmap of our own past, what other secrets is it still hiding? Right there, under our skin. Thanks so much for playing along today.